Now to that new study that's taking a closer look at how the coronavirus pandemic affected various demographics in Nueces County. The study not only shows how Hispanic and Black residents have been hit harder by COVID-19, but it also spotlights some of the social and economic disadvantages they face, which led to higher rates of disease, death, and loss. Our Michael Gibson breaks down that study for us tonight.
This is the Texas Health Institute's final report that focused on health data for Nueces County residents before and after the start of the pandemic. The goal was to come up with an accurate overview of the factors that shape everyone's eventual health. The nonprofit put the information together for the Nueces County Office of Emergency Management and the hospital district at a total cost of $503,000. One thing that the report found was that Hispanic and Black residents have higher COVID-19 rates compared to their share of the population. You can see that Hispanics make up 64% of the county, but 68% came down with COVID. White residents make up 29% of the population and 27% tested positive. Meanwhile, 4% of Black residents had COVID, while they make up 3% of the folks living in Nueces County.
It's not strange or random, if you will, that we know that those people most vulnerable and or affected in certain areas are going to, have a higher positivity. Because why? Because they're on the front line. They're exposed more.
The study also found that those folks who live on the city's north side have a life expectancy of 70 years, while those who live on the east side of town in higher income neighborhoods can expect to live up to 85 years. Some of the contributing factors listed were high rates of obesity and diabetes among those north side residents.
If I live on one side of town, my life expectancy is so radically different than if I live on the other side of town. We've got to make sure that that is not our future. It might be our present, but I have to believe that with some serious focus and some very important acknowledgments of what's going on, that we have the ability to change that.
Dr. Jacqueline Phillips is with the Amistad Community Health Center. She provided information to the authors of the study, but one of the most surprising findings of the study that she noticed was the effect education had on people's health.
People that don't have a diploma tend to have poorer outcomes. So the high school diploma didn't guarantee you better outcomes, but definitely if you did not have a diploma, you had poorer health outcomes.
Another goal in all of this is to be able to have the actual facts and statistics to show the state and federal government what kind of help residents in Nueces County actually need. Many times, grants and other programs are awarded strictly on the basis of the size of a county. The judge says, with the results of this study in hand, the county can now go after even more money to try and turn around the health fortunes of so many people who have been historically underserved and overlooked. Michael Gibson, 3 News.